Jamie Indicalpo, your student nurse. For today's video, I'll perform a return demonstration to assess the skin, hair, and nails. But before we hop into that video, let me show you what equipment we'll need for today's assessment. So without further ado, let's get started. So before performing this procedure, we have to perform proper hand hygiene and don our PPE if necessary. After that, we can now proceed to the assessment. Good day, ma'am. I am Jamie, your student nurse from Our Lady of Fatima University. So ma'am, for verification, can I ask what is your name?
I'm Hazel May Campili,
And when is your birthday?
May 11, 2003.
How about your age, ma'am?
I'm 19 years old.
So that is the first thing that we need to do. We have to identify our patient for us to ensure that it is the right patient in front of us. And kung mayroong curtains or doors sa room, we have to close them as well in order to provide privacy. Then, after that, we have to explain the procedure to the patient. So for today, ma'am, I'll assess your skin, hair, and nails. And ginagawa po natin ito to ensure that everything is normal. And if there are any abnormalities on your skin like discoloration or skin lesions, and we are going to note them to prevent any further complications. And ma'am, to assess those parts po, can I ask for your consent if it is okay to touch certain parts of your body?
Okay.
Okay po. Rest assured po ma'am na all of the documents na manonote ko sa ating findings is completely confidential between the attending physician and me. Is that okay, ma'am?
Yeah, okay.
Do you have any questions, ma'am, before we start?
None.
Alright, if may question po kayo later during the assessment, you can ask me po. Since I already explained the procedure to you, ma'am, and I'm handling this patient gown so you can change with this one. Okay, ma'am, please change po. We also want to get a towel or a blanket because it will serve as the cover to expose part of our client. We have to remember to expose only the parts that we are going to examine and kailangan natin i-cover yung parts na hindi natin i-examine. So yung patient will remain seated most of the examinations but will need to stand or lie at the side if we're going to inspect the posterior part of her mouth. So we can now proceed to the first part of our assessment, which is inspection. Ma'am, I'll be inspecting your color variations on your skin. Can I hold your arms, ma'am?
Okay.
So here, iti-check natin if may any signs ba ng pallor, cyanosis, jaundice, erythema, and vitiligo because that may indicate abnormalities sa skin. But as I am assessing your skin color is medium brown, and there is no coloration and wala ka namang sign ng abnormalities sa skin. Okay ma'am, I'll just get the magnifying glass so I will clearly see if there are any skin breakdown. So I observe na you don't have any skin breakdown, wala rin pong redness or patches, and yung skin niyo po is intact, which is good po. So now we want to inspect skin lesions. Can you raise your hand again, ma'am, please? We are trying to see here if meron po bang signs of bruises, wounds, insect bites, or scratches dahil kapag meron po, means may abnormalities sa skin. At sa nakikita ko naman po here na there are no skin lesions present. But if there are, we want to note their size, shape, and color as well. So skin lesions can be primary like macule and papule. It can also be like secondary like fracture, ulcer, or fissure. Or it can also be vascular like hemangioma. And in worst case, it can be a skin cancer like malignant melanoma. So if we notice any signs of skin cancer, we want to evaluate it using the ABCDE pattern. And we want to note its symmetry, its border, color, diameter, and its elevation. And pagkatapos natin i-inspect yung skin for any discolorations and lesions, we can now proceed to the second part of our assessment, which is palpation. Here, the first thing we want to assess is the texture of your skin. Can I have your arms, ma'am? I observe here that there are no present stretch marks or scars on your arms. Yung texture naman po ng skin nyo is smooth and there's no any infected lesions presented on your skin. Next, I will assess naman po your temperature using the dorsal side or yung back po ng hand ko. Gamitin natin yung dorsal side ng hand natin because this is more sensitive to temperature. Our palms and our fingers have thickened skin and have higher blood flow. That's why they are less sensitive to temperature. Ilalagay ko lang po yung hands ko sa forehead and sa face niyo, ma'am. So we are trying to feel for any signs of fever, shock, or any signs of infection. I have observed that your skin is warm and hindi rin po siya masyado mainit. Wala naman pong nag-i-indicate na kayo ay may sakit or sinat po. Remember na kapag mag-a-assess tayo sa mga open skin, we have to put or don our gloves. Sa pag-assess naman sa moisture ng client, we need to remember that moisture on the skin folds and moisture on the axilla is normal. Pero, any signs of excessive dryness or excessive moisture is already abnormal and we want to take note of that. Sa na-observe ko naman po sa inyong skin, hindi naman po siya dry, hindi rin siya oily, and that's good to know po. The next we want to palpate is for the skin turgor. And to do that, we have to expose the part or the skin just below the clavicle of our client. And in assessing the skin turgor, we want to pinch the skin below the clavicle. Kapag yung skin ay bumalik agad sa normal, that means there is an absence of skin turgor. Pero kapag the skin stays pinched, that means there is a presence of skin turgor. At yung presence ng skin turgor indicates dehydration. So, we want to take note of that. And as I observe here in my client, there is an absence of skin turgor, which is normal. And nung pininch ko po yung skin nyo for turgor test, it has mobility also, and that's good to know. And lastly, in assessing the skin, we want to palpate naman po for edema. Can you put your foot here, ma'am? So, sa pag-assess ng edema, we need to apply pressure sa skin. Kapag yung skin becomes indented, ibig sabihin, there is a sign of edema, which indicates cardiac or kidney failure. Pero kapag yung skin bumalik agad sa normal, that means there is no sign of edema. Can I have your other foot, ma'am, please? I observe here that it looks like there's no signs for edema. And observe ko rin po na yung skin nyo is thick and that's good dahil kapag ito ay thin, it may indicate steroid and arterial insufficiency. So now we are done in assessing the skin of our client. We can now proceed in assessing the nails. Ma'am, before we start in assessing your nails, may I ask if you have any questions? Okay po. Can you raise your hand, ma'am? We want to inspect for grooming and cleanliness, color and markings, shape and palpate the texture and the consistency of your nails po. Can I also see your toenails, ma'am? Okay po. Next, can you also do this one? Para po ma-assess ko po yung consistency ng iyong nails. Alright, thank you. As I was inspecting your nails, it looks normal naman po at wala naman pong sign ng abnormalities. And na-observe ko rin po na yung nails nyo is quite clean and groomed. Na-observe ko rin sa client na pink tones yung nails niya and she don't have any loosened tissues on her nails. And also, her nail base angle is in 160 degrees angle. So that's good because it means that her nail is not clubbing. So yung next na i-assess natin is yung capillary refill of your nails. So ma'am, in doing that, I will apply pressure on your nails. If yung color po ng nail is bumalik agad sa normal, means the nail has fast refill and that means it is normal. But, if I pinch it at hindi agad bumalik sa normal, it means that it has slow refill. And slow refill on the capillary is a sign of respiratory or cardiovascular disease that it may lead to hypoxia. Ma'am, can I also see your toenails? So here I observe na yung color po ng nails nyo is bumalik agad sa normal and that's good po. And the last thing that we will assess is the hair and the scalp of our client. But before that, we want to don our gloves. Okay ma'am, let me just don my gloves for a while. So here we are trying to see if there are any signs of lesion, infestation sa scalp and hair, if there are any flaking sa scalp and lice on the hair, and we will take note of that. But as I was inspecting, your hair and the scalp seems normal. Wala rin po akong nakikitang any signs ng scars or lesions, wala ring parasites and infestations, and wala ring oiliness and dryness when it comes to your scalp. And I also observe that there is no presence of hair loss that may lead to alopecia, and that's good to know. And that's all for the assessment of your skin, hair, and nails. Thank you so much ma'am for your cooperation and have a nice day. So after that, we will remove our gloves, our PPE, and we will perform proper hand hygiene. But if there are any signs of abnormalities, we will refer them to other healthcare provider for further evaluation. And then, after that, we are now done in the assessment.